Hello and welcome to the Ryoho Wellness Podcast. This is Margit Jefferson and I am here with Andrei Gospodarczyk, the founder of Ryoho. The vision behind Ryoho Wellness is to create a tipping point in wellness worldwide, and this podcast will contribute towards that. In each episode, we explore different health issues that present as case studies in Andrei's practice. They range from everyday common health problems through to extremely serious health issues and illnesses. We explore body parts and how they respond to nutrition and environment, and we work on inspiring people to change their life for good through an everyday wellness focus. Ryoho is a wellness modality that is unique because it focuses on healing and wellness through basic food and exercises that maneuver the body back to a state of balanced health. People literally jump out of their skin with energy and vitality when they follow Ryoho. And it's an incredible turnaround for many who have had low energy for years through to people who have had complex health issues that don't seem to budge. The podcast is an interview format and ranges from 20 to 60 minutes. And if you'd like more of an introduction on Andrei, please see the 3-minute introduction in the first podcast on the homepage. And at the end, I'll be here to give you a little bit more information. So without further ado, let's get into this episode. This podcast presents a series of case studies of patients that have presented with back pain at Andrei's practice, and he has highlighted a number of different conditions which are extremely common and which you may relate to and which may provide insights as to why you are suffering back pain or why someone you know is suffering back pain.
Okay, let me tell you about some of my patients. Now, this might give you a little bit of hope because it might relate to you. You might feel some affinity for these patients, similar conditions, where it'll inspire knowing that you're in the same boat.
So the first case study presents as a patient with arthritic and degenerating bones.
One of the cases that you might find interesting to know about, and it might relate to you, is I have a client where all her bones were so degenerated that she couldn't actually put weight on her hands, that her wrists were agony, and to touch her ankles just lightly, she would scream out in pain. Everything was arthritic and degenerating. So, of course, she had a very bad back. Now, what's interesting is that within a few weeks, the wrist pain and the ankle pain had completely gone, where she could actually do gentle push-ups, which was a marvelous revelation for her. But even a few months later, her back was still sore, and she couldn't understand why. She kept on saying, I'm doing all the right things. And I kept on asking her what her diet was about and whether she's doing the right things, and she would always say yes. And then one day she came in and said, my back's really sore, can you help me? Which we did, of course. And she said, I shouldn't have gone to that party and drank so much alcohol last night, should I? I should really stop the alcohol, shouldn't I? And I said, but you've known that for a long time, and that's why your back is still sore. She said, yes, I knew that, but I didn't really know it. It's like a big issue for all of us is that when we're dealing with very deep, very chronic illnesses and deep problems, that the demon, the bad food, the cause of the problem becomes entrenched within us. And it's very hard to see that it's part of the problem because it's become part of us. And it takes a very specific event. But you'll know that eventually you'll find the cause of your problem, that you will eventually see that, oh my God, I'm still drinking coffee. I didn't realize I was still drinking coffee. That I am drinking enormous amounts of liquid. I am still eating sugar. I didn't realize that these substances were considered sugar sources also. It's an interesting process that we go through. As we heal a little bit, then we can heal a lot more. Just keep on the path.
This next patient case study is about a patient who presents with scoliosis.
There's a condition called scoliosis, which is a very distorted spine. It's twisted so much that you end up with a hunchback. Your head sits to one side, your hips are thrown forward on one side much more. Shoulders are very different height. It's a severe illness and, of course, associated with enormous amounts of back pain. Now, I have people seeing me with scoliosis, and we give them exercises to rebuild the muscle and no one seems to know where it's caused from, but we know that it's, of course, a hormonal problem. It starts in early teens, and we can correct that by building muscle tension to pull the spine straight again. It's just a concerted effort. Now, after about 3 weeks, normally people like her have enormous relief. What's interesting about this case study is that even though all the pain was gone and the results have been miraculous for her, that as soon as the pain was gone, she would relapse back to her bad diet again, because the impetus, the reason for her trying to correct the problem was the pain. The pain was the reason she was changing her diet. As soon as the pain went away, then she had no reason to eat well anymore or to do her very sensible exercise regime to keep straightening her spine up. So what we had to do was shift her motives from avoiding pain to looking for pleasure. And so we started to use her shoulder height as a guide to success. So balancing her shoulder height was the new goal. Try not to use pain as a motivator, because with this program, you'll find that the pain disappears very quickly. Look for pleasure as your motivating source, more energy, a happier, lighter disposition. Have that hope rather than a negative to inspire you.
This next patient case study is a patient who has presented with fused back and experiences a lot of pain.
One case study that you might find very interesting, might relate to you, is a lovely lady in her late 40s that has had 2 of the vertebrae in her lower back fused. And in her case, it didn't help at all. Now, a lot of people do get a percentage relief and they have maybe half their pain go away. Some people have all their pain go away, but it's only solving the symptom. In her case, none of the pain went away. In fact, it was worse, which is a possibility with fusing of the spine or back operations to solve back problems. Now, changes in her diet created good relief in the back pain. Just initially, she lost a little bit of weight, but she could only go so far, where she had a percentage change. But because the spine was fused, then we had to work very specific aspects of her body to create more change. So that's where your feedback is very important. Don't give up. Even if your spine has been fused, even if your spine has been operated on, your unique case still can be dealt with. If you have some little success, that'll inspire you, hopefully, to wanting more success, but it might be difficult for you. So let us know what your results are, and we can guide you through maybe your specific case, your next step.
This next case study looks at how overweight people have back pain.
Having the burden of excess weight is creating a lot of pressure on your spine. We regularly see people with a lot of weight carried around their belly, their middle, and even on their back, into their buttocks and thighs. It makes for very awkward gait, a very difficult way of walking. It puts a lot of pressure on our spines, and it's easily solved with a change of diet. The hard bit is changing your diet, of course. What people don't realize, and what a lot of our clients don't realize, is that by adding good food to your diet, it stops you from craving bad food. Those strong recommendations of adding oats and brown rice to your diet are absolutely essential, even if you can't change anything else. And it gives you the good nutrient that then stops your food cravings, and you'll find that weight loss occurs. And as soon as your weight goes down, for a vast majority of people, there's massive back relief. And then a little bit of gentle exercise, and the muscles tightened up, your spine straightens up.
This next case study presents a very skinny person and why they have back pain.
So the spine houses the nervous system and supports the brain, the head, which is pretty obvious, but a lot of us don't realize that when the nervous system becomes terribly overactive, the spine becomes very tight. The neck, the shoulders, the lower back aches constantly, and we call this nervous tension. You can end up very skinny. These people live on sugar and coffee, and alcohol. That's the extreme, of course. Very little food in between, maybe just the occasional binge eating, but they end up with constant neck, shoulder, and lower back ache. It's easily resolved with good nutrition and a little bit of rest. And these cases I see common. I see people like this a lot. One recent case was a young lady, only in her 20s, very nervous disposition, her hands twitching. She was picking at her nails all the time. That picking at your nails and biting your nails is a sure sign of a nervous disorder, which is associated with her lower back pain. And that lower back pain was a rotation in her hips, which was also then supporting a chronic, long-term, agonizing hormonal problem with them leading to menstrual pain. So it took a little while, just 3 months, but not long. And after 2 weeks, the blood had changed a little bit. And in 3 months, totally pain-free. And then put on weight, which was a wonderful thing for her, and her parents received letters of gratitude from. But for her, that nervous disposition and biting the nails, and that all disappeared very quickly. It's just a sign of the spine deteriorating.
This next case study is about the gym junkie, who in theory should be incredibly fit, but also suffers back pain.
A lot of the people I see are concerned about their health and they think they're doing the right thing. One of my favorite people is a lovely young man who's considered a gym junkie, loves his body, wants it in perfect shape, works on it continuously, goes to the gym, weights, lifting and exercise and jogging and all the rest of it. Now, because he pushes his body hard, he felt that he needed nutritional support, so he went for guidance. And he was told to have a lot of protein shakes. Now, this had a very debilitating effect on his back because the protein shakes, these powders, these smoothie drinks, very high in protein, threw his nutritional balance right out, made his bowels swell more on one side than the other. This shifted his muscle tension in his back, threw his spine out. And he was in agony when he came to see me. His friends carried him in. Even if you're bedridden with a bad back, you can still follow this advice. Change your diet, do gentle exercise of moving your knees left and right, as you'll see in the program, and that back pain will heal. So gym junkies, bedridden, where you're in crippling pain, where you can't sleep, can't move, and any little movement is agony. Don't worry, this is the right advice for you.
This next patient is very common and suffers back pain due to a lifting injury.
I see a lot of emergencies. Just very recently, I had an emergency phone call where someone was moving some furniture and they put their back out. Now, this is a common thing, of course. People lie down, hope that they recover, and generally they do, but it's a sign that your back is weak, that you shouldn't have this sort of thing where you go to lift something and you throw your back out. It means that the muscle tension in your back is unbalanced, that you're leading towards a bad back, and that's been aggravated. Even problems like scoliosis, people might blame carrying books or heavy satchels or lifting furniture, but you have to be set up for this. In other words, your back has to be a little bit out of balance for you to develop a problem here. You might get a little ache, you can feel your muscles straining, but it shouldn't throw your back out. You shouldn't injure yourself from doing something simple like lifting something that is a little bit too heavy. You should feel that it's too heavy, you strain your back, you can't lift it, you're fine. It shouldn't push your bones out. The reason that it does is because the muscle tension is wrong. Finding the weak side and working on that to balance your muscles again, finding the cause of that imbalance, that's what the Ryoho lower back program is all about. So if you've put your back out before, just like this person, and even if you've recovered, it's still an important thing to know that you're favoring your back. You'll notice it in yourself that you hesitate in doing things. You'll hesitate in jumping over the fence. You'll hesitate in doing some running or playing some sport. It's there sitting all the time. You're avoiding your back because you know it's not right. Make it healthy, get back into life.
This next patient simply presents with constant lower back pain.
A lot of the people I see have constant lower backache. It's a very common thing where every time they stand up, they can feel their back ache. So they've been sitting for a little while, they stand up and they have to bend backwards a little bit to relieve their back ache. Every time they bend over to pick something up there, they can feel that little strain in their back, that little ache. This little ache is not going to go away by itself. Generally, they're in their 20s and 30s, which is ridiculous, of course. It used to be only the realm of those in their 50s and 60s that would feel this sort of thing. But modern lifestyle has created this. If you're one of these people, just know that this is a precursor. This is the beginnings of a bad back, where it's aching because the acid levels are too high in your system, and a good diet and regular exercise is absolutely necessary for you to maintain your back health. Now, it's very simple. All of these people that I see have this regular lower back ache. All we do is get a little bit of a healthy diet happening. Make sure that you're not unbalanced left and right. Follow the program and know that a healthy, vibrant back is going to support you, and you'll find that your mild levels of anxiety or neck tension or shoulder tension and your energy levels will all change. So people come to me regularly with this mild backache, and then they discover that it relates to a whole lot of other little minor issues. If you're one of these people, know that a lot of minor issues are associated with that backache. You shouldn't have a backache from just sitting for a little while. You shouldn't have a backache from when you wake up in the morning. And you shouldn't have a backache from doing anything simple. Like, it's not normal. Don't accept it as normal.
We hope you've enjoyed this podcast episode on back pain case studies, and we sincerely hope that it's given you some hope and inspiration that there can be something done about back pain. Any listeners who would like to learn more about Andre's work or Ryoho can connect and follow on Instagram and LinkedIn using the address of Ryoho Wellness. We spell Ryoho Ryoho and then add wellness on the end, obviously. Episode notes will be loaded up and available at ryohowellness.com, which is the master website. And just a few more things before you take off. Number 1, do you have a health issue or question you would like explored in one of our podcasts? Please submit it to us at the website where there is a contact page, ryohowellness.com website. Number 2, would you enjoy being notified by very short email every time we do something on Ryoho Wellness? This includes notification of our up-and-coming wellness podcasts and other things towards our tipping point. If you want to receive that, go to ryohowellness.com and drop in your email address and you'll get the very next one. And we hope you really enjoy it. Thanks everyone for listening, and thank you, Andre, for another fantastic episode. See you next time.